So, good morning, good afternoon, good evening to whichever part of the world you're watching in. You have tuned into BRiK Academy and you're listening to Candid Conversations with Industry Experts. And I'm your moderator, Mihir Pujara. From India to US and from consulting to Core Pharma, the expert we have today has seen it all. With over 17 years of experience, Pulkit Guglani's journey exemplifies the power of sheer determination, passion, and purpose. Pulkit started his journey working with organizations like SmartAnalyst and GSK. Then he had almost 8 years of stint with Dr. Reddy's laboratories, starting in Hyderabad and then in US. And currently he is serving as a head of forecasting BD&L and pipeline at Takeda Oncology in US. He is a data evangelist and somebody who is passionate about impact of AI in data-driven decision making. He has been a speaker at multiple global conferences and events. And if I talk about his expertise in therapy areas, so be it oncology, immunology, or neurology, Pulkit Guglani is a unique blend of scientific acumen and commercial insights. So today, in this podcast, I'm going to peel back some of his career insights, life lessons, leadership ethos, and what goes behind the curtain in making a professional like him succeed in pharmaceutical industry as well as life. So without further ado, let's get started. Pulkit, welcome to BRiK Academy, having you with us today.
Thank you, Miguel. I think it's honored on me. Really pleasure to be invited here and being part of the your podcast series. Really excited. And that was a hell of an intro, by the way. So thank you for that. I think
No,
that makes my
it's
just listening to that makes my morning. Somebody talking about me.
pleasure is all mine. And thank you for your time again. So let's get started. Let me take you back to your early days. And being a pharmacist, I'm curious to know how pharmacy happened to you, whether it was a conscious choice or it was a forced decision.
Let's be honest here. I can give you a corporate answer, but let's be honest here. Pharmacy. I think we used to crack a joke in our final year to our freshers in college that nobody chooses pharmacy. Pharmacist chooses you. So I think that happens in my case. One thing which was really a trigger for me is my dad died of cancer. I don't want to make it very serious, but my dad died of cancer. And he asked me, like, hey, why there is no cure for cancer? That kind of intrigued me to go in medicine. Now I was not, hardworking enough to get into become MBBS and go to a doctor, but that was the closest I could get was B Pharma, not the prior option, but yeah, I built my entire career in pharma, and whatever happened, I'm really thankful to God. And uh, now I think I'm passionate about what I do.
Indeed.
Yeah.
No, indeed, you are at the peak of your career in pharma, and a lot of people like me also seeing your journey. So definitely impactful. Now, Pulkit is also my senior from Department of Pharmaceutical Management, Naipur Mohali. And I cannot leave you without asking this question about those Naipur days. And I think you have had a follow-on education at IIM Ahmedabad. So how this, I mean, both journeys has shaped you as a professional?
Yeah, I think yeah, Nipper was fun. A lot of learning, fun, and everything. So I had a really, really great time. Like everybody else, holidays are great. So yeah, of course, I can get started and not stop, but I keep it the what is more relevant. I think Nipper gave a different angle, right? Coming from a regular B Farm college in a small town, you going to Nipper, all the passion you had. So it was interesting story how I ended up going to Nipper. I tell people I had my bullet. I used to live like 3 hours away from Nipper. So I started my bike, put money in the bag, and then to Nipper when the counseling was there. I went there and I had choice like MS or MBA. And I see my seniors who came from summer intern and were in jackets and tie, and they were like fully dressed, talking to people or anything. Like, wow, I want to be like, that looks cool. And like, okay, I'm gonna do MBA. And I think that was a great decision I made. I just saw how the world is changing and how MBA could become more important or was already there. So I picked Nipper MBA, and it was great journey, uh, great friendship, dancing peacocks in a rainy season from your window, how you can focus on studies, of course. Beautiful environment, great friends. But what I learned, everybody was so pioneer or apex in their field, right? They have closed certain bars to go there, and they were really working hard to be good in do good there in life. So just by being there, if you are not studying, talking to people, they are talking about what's going in pharma, how it's going to impact. People are reading newspaper, discussing those things, even on a fun way. But when you are in that environment, that changes you. And that's what I felt going into Sniper MBA and coming out, that I have changed a little bit. I think more industry wise, I can talk about certain things. I feel more confident. And luckily, that gave me a platform to start my journey as well. Yeah, I think a lot of learnings and in the career start, which is always rememberable.
No, indeed. And I think what fascinates me about Niper is that all the Niperites, right? We all came from very humble background. I think most of the Niperites. And it's indeed a great achievement. Now we are almost 835 alumni across the globe. And I just made that database of Niper MBA alumni, and we are almost present in 20 plus countries across the globe. So in itself is a significant achievement. I think your follow-on journey with IIM Ahmedabad, how did that happen, and what were the learnings from it?
Yeah, I am Ahmedabad actually was in parallel to my role at Dr. Reddy's in India. So it was not a full MBA, it was an advanced analytics program where I learned some tricks of regression analysis and stats analysis, statistical softwares and stuff, which is now called AI, but at that time it was called statistical analysis and regression analysis, and now people call it AI. Uh, but yeah, that's what I learned there. And to be honest, until now, I think what I learned there wasn't seemed very useful. Until now, when I see AI coming in and I started using it or implementing some of those things in my work, I said like, yeah, this is the work I used to do there, but I think, yeah, it was ahead of the time what I learned. Maybe it is still will become more. It's becoming more relevant now, I would say.
It's fascinating. And I think which year we are talking about?
2011, probably.
Wow, 2000. Okay, okay. No, it definitely shapes your thinking. You are ahead of your time, definitely. Now, if I just come back to your corporate journey, and I think you had your beginnings with consulting, followed by a stint with DRL. So, if you just highlight some of those experiences from early consulting days, and usually, right, in terms of making a career choice, people either always stuck between going to consulting, going to core, and how to shuffle between these two. So keeping that in mind, how do you see your journey on both the sides?
Yeah, that's a good question. Uh, so yeah, I think I always want to try both sides. I'm a guy who want to try it before I learn. Like, that's how I learn it. I want to touch it to see how it feels. Yeah, I think career start is usually whatever options you get during the placement, which was very great. I think working with SmartAnalyst and GSK actually made a very broad base for forecasting. CI, I learned like how to like real pharma looks like, how this word is. Offshore was at peak that time as well. I think that was the initial peak before GCCs came in. So it was a lot of good learnings, but there was always like what's happened on the other side of the table, like how decisions are being used. Uh, and there was always like Novartis was setting up or already set up, but it was new. So Novartis was expanding in Hyderabad. Like every day you will, at that day, anybody will get like 10 calls a month from Novartis itself. And there were other companies. That was a great time to build career at that time. In consulting, everybody was going. And I was thinking, no, I want to go in pharma. People in pharma were moving to Novartis. And I was like, no, I want to go to pharma and see there. And Dr. Reddy was setting up their brand business. They have an proprietary brands in India. And they were like, hey, we're going to set up, they have labs and everything. They need people from commercial analytics who can, set up the new portfolio, give new ideas. And I was like, yeah, I got an opportunity. I met there, one of our alumni. Uh, when you talk about Niper, it's never been a journey. I went somewhere and I didn't find a Niper, right? I mean, in a hand away distance from me, right? So there is a strong connection. So I met people from Niper, ex Niper, and I learned a lot, and then set up a different journey altogether, working in core. I was doing the similar thing like I was doing in consulting, building forecast, looking at portfolio, but I was presenting to very senior leadership. I went up to present to CFO, CEO offices, and sitting in those meetings. It gives me how decisions are actually made, how data is actually used. That live actually changed how I used to present the slides, first of all. And how I talk about my numbers. That narrative is very important. I learned over years, and those experience of working on both sides of the table really shaped how you think, how you narrate your things, especially around numbers, how much detail you need to go, how much on the surface you have to stay. So that balance really helps there.
No, indeed. I have also served the Glenmarks and Ciplas of this side of world, so I can definitely relate to the decision making you talked about. Now, I would like to dive into the business development and licensing, and you were part of some of the groundbreaking deals, right? As per your profile, I'm very curious to know um, on the technical side of the deal as well as on the people side, right? What were some of the key learnings and your experiences?
Talking about BD, I think it was broad. I have done both. Uh, the one of the largest deal for Dr. Reddy's, divesting their neurology franchise to the company called Lakshman Smith, and we setting up those franchise and then selling it, taking lead, going to bank JPMs, and talking to bankers. Lot of stuff when my kids were like a week old. So there was like doing BDD at home as well as outside, but it was a fun time. I learned a lot. Started there in a BD role, more like in a front end BD. Uh, and now that was a journey. We were like two people in BD at Dr. Reddy's, me and my boss, and we are doing end to end thing. I was building models, doing deals, talking to bankers, talking to partners, sitting on negotiation table, sitting with legal on contracts and looking minute things and entire spectrum of BD deal that would happen on the brand side. And that was the same on the both side, but the nuance are very similar. So learn there, but now at Takeda, when I see a lot of applications there, and now teams are bigger, my role is very specific to business assessments and building those forecasts. But those things helped a lot, right? And as you mentioned, one is the people itself, and one is the process. And I think people drive the process. So let's don't forget, it's all about how you build a relationship. Any analytics guy or forecaster like me has to go through pricing team, API teams. When the company is large, you have to deal with different people whom you're gonna, brainstorm and get the data from, inputs from your CI team, your market research team, right? So you are so dependent upon other people inputs, and that is going to drive your number. It's not your number. It's input from other people, which is driving the output. And then you are there to justify each of their work and support the output with certain rationale. And I think that whole process is meaningless if you don't bring people in. If people are not aligned with you, the number is going to get wrong. If you are not pushing back on people to get the right input, you're not going to get the right output. So I think people are very important. And luckily, most of the time where I worked, I got really amazing people. Uh, and then there are few people everywhere where give you a more opportunity how to deal better, how to deal different, and sets you more mature how to behave with people in certain way. But overall, it was a great journey. And I think what really I like about people when you are in front of leadership presenting your forecast, if you have made that relationship, you will have advocates in the room rather than people who are asking questions. And that is very important, sets your trajectory differently about what you are going to say in the room if you have advocates around you. So I think they are both people and process are all overlap, but I would focus on people a little bit more.
So now, you brought a very good element about process versus people. And now, since you are at a decision-making level, I would also like to ask, in making a decision, whether it's data coupled with instinct or it is just data, which drives the decision.
Yeah, I think good question. And this has been a challenge, right? Let's pull back and see what exactly we are going to do. We are making decisions, but in the bigger frame of things we are working for in our organization, everything goes through a process, all right? So it's my instinct, his or her instinct, right? And instinct can be different, right? But instinct is based upon our past experience, what we have seen, what we have read, and other people have read, what we have listened to other things. So we don't have to discount anything or discontinue from our process. But being a data analyst guy, I'll always start with data because there's less bias. Instinct can bring biasness, uh, but data is data. It depends upon how you slice and how you say it, and it can be an illusion if you are not looking at the entire picture. So start with data, believe in data, but bring your instinct and other people's instinct. And I think that's very important. My instinct could be different, but I have launched just a couple of brands. There are people in the room may have like launch and spend their career bringing products to the market. Their instinct will be entirely different, right? So we have to bring the group instinct with data to make it right. And I think that should be the fact that at this level, we don't have the perfect data and we don't have the perfect instincts, but group instinct plus data is the way to go.
No, indeed, that's very well put. And I think as per your LinkedIn profile, you have won an PM 360 award. So if you can just elaborate what that was all about.
Yeah, I'm glad you asked that question. I always bring that up in my conversations as well. Yeah, so this is a bit of tension to my everything I've been doing. When I came to US, I worked with part of Dr. Reddy's from his pharma specialty company. We launched neurology franchise. We launched new brands for smaller brands for migraine. And I was running a marketing campaign on Facebook, and we had no time for migraines. There is a still, I think, a website alive. Uh, we talks about migraine, work with influencer, bloggers. Instagram wasn't much popular at that time, but Facebook was. So worked there, marketing campaign, working with Salesforce, a very niche experience. Uh, and it was got much appreciated what we brought on the table from physicians community, from patient community, and you can see patient changing their lives. That was very motivating. In the end, it was also appreciated by industry. So there is a magazine or a forum called PM 360. It's the Apex, kind of an Apex magazine for pharmaceutical marketing space in US. They give awards to best TV advertisement, DTC ads, marketing teams. So our team won Trailblazer Silver Award uh, as a specialty company in 2017, which became a highlight as well. There was a whole event in New York City where celebrities were there and stuff. So, you see, and it's in public, it's in news. But that experience give me a checkbox. Like, if you are courageous, you go anyway. Be, able to grind yourself and challenge yourself. You can do whatever good you want. And that's the story I stick with. It's not about award. It's more about I never done marketing before. It was more data analytics guy, but I can be a marketer if I really want to be, or at least contribute in a significant way that can lead to accolades by the industry, right? Yeah. So be courageous. That was the morale for me, which I learned, plus the award, which was a tick mark of there was a good work being done.
Super. Now diving a bit more deeper into the courage element you spoke about. So you worked with an Indian pharma based out of India, and then you moved to US. How challenging it was working with the same company but in a different geography, and then building a successful career now in US. I think you switched to then after DRL, you switched to again consulting, and before joining Takeda. So how challenging or how difficult it was in a different territory, in a different geography?
When I say the word courage, probably I thought like I jumped on a wrong platform. I was thinking something gonna come. US versus India. I think yeah, there are stark differences. It's not right and wrong. One difference day one I found was everybody comes on time and leaves on time. And like which where happens? I never seen in my life. Who comes on office on time and leaves on office on time in India, right? And there was no chai tapri break, there was no suta breaks in between. As like, okay, this is different culture on the surface because people have their own busy lives. So they come on time because they have a lot of stuff they have to do at home once they get back because there is no home help. So there is a different perspective. But I think at broader scale, if you go a little deeper, things are pretty much same. Human beings are human beings. Relationships are very important, both in India as well as US corporate culture. Now, every culture bring their own layer of things in the corporate world as well. And that's where the US is as well and India as well. But those stark difference, if you go deeper, I think I learned a lot on certain things, how to put up things, what really matters. People are uh, very hierarchical here as well. Usually we see people calling by each other name. I used to call sir to many people. I have to leave that thing aside. I know people who started in consulting India are not still used to telling sir is gone away. That's not a culture anymore. But certain culture still was there when I was there. So there was no. Luckily, I worked with very nice people. My boss was from Harvard MBA. He was like full through. He understand Indian cultures. He understand different aspects, and he always pushed me, ask me questions. So one instance I'll give you, which changed how we work, and it was my time back there. Dr. Reddy's India versus US. Just that example, not the entire Indian corporate, but just talking about one organization in different countries. And it's about psychological safety. We talk about nowadays psychological safety training and stuff. But back there, I used to like in bigger meeting when senior leadership is there, you stay quiet. You don't ask question to them directly. And in the back, I went and I asked my boss, like, hey, this thing was presented. I think doesn't align with data, what we said. It's like, why didn't you ask in the meeting? It's like, no, I'm bringing it up to you now. It's like, no, you should bring it in the meeting and not bring it to me, bring it to the audience. That why you are there to listen in, to show your attendance, you are there to ask questions. And as a guy who usually gets slapped in school because you ask a question, whether it's matter or not, we tend to have like, I don't ask question until unless you will get a hard time back of the mind. So I stopped asking questions overnight. But coming to US and being pushed for it, and then when he saw he will not speak up, he will say like, hey, okay, this is data. Do you want to speak up? Anything? Does it look to you? So he really pushed me to ask question, and that changed. And over the time, I am asking a question in a certain way, how to ask in a better, assertive way. Right? Something comes with age as well, but certain things come because you have never experienced. So all those things was a journey, and I think that was a big difference when I say uh, the Dr. Reddy's India versus US. There was the openness to ask question, openness to push back was there, which sticks with me. I think I motivate my team as well. Okay, don't forget to ask question. You can challenge me, make me wrong in front of public, but you should be better right, or we should debate about it. So, and then how to put it. That's another way to go deeper about it. And it sticks back to courage. I agree. It's be courageous to ask question, push back, and then learn what's the best way to ask those things, what words, what tone you have to, body language you have to use when you are asking or pushing someone, right?
Thanks for bringing this important topic. I think not asking a question is very much linked with Indian upbringing, right? So, and eventually with experience, a professional acquires that courage and right intent to ask the questions. It's not about right and wrong, but it's about speaking up, showing up. And thanks for spotting that amazing insight. Now, since we are discussing US versus India, I would also like to ask because a lot of people, right, wants to make their career going to US or going to any other country. But times have changed, right? Things are not the same as it was a decade ago. What is your advice to those professionals uh, who are just eyeing foreign land to make their career with a mindset of grass is greener on the other side?
Yeah, I agree. Maybe I know where you are going. I think you are a better person or Viren who can talk both sides better, but I'll give my perspective there. Uh, if the intention is green to go where grass is greener, just stay where you are. If you are in an area where it has a maximum growth, I mean, indicators show that economic indicators, the growth of GCCs, McKinsey called India the brain of the 21st century. That if you need people and talent in analytics, in consulting space, in service industry, you need to be in India. That's where the brain is. That's where the raw material and talent and processing is going to happen. Any company, any industry. If you're in manufacturing, you need to partner with China in some form of manner in your value chain. Same in the areas like data analytics, AI, pharmaceuticals, you have to have India presence in your vertical, in your value chain. So you are at the right place. People who are thinking just because grass is greener is not. It's India is a green pasture. What I say when people ask me this question, and many offshore people, I push them to come over here also. So it's just both things are good and bad. Come here, live for a while, or visit here, see for yourself, and then make a decision what's good for you, your family, your career. Uh, Everything brings all good things also brings certain more things which people won't like, right? So it's your personal decision. There is no right and wrong. Career wise, India is great if that's a move, or if there is other topic, come here, live, and then decide yourself. uh, it brings its own challenges. I don't want to dive in there and scare people, but it brings their own challenges, and be open to that. If you want to move, you have to be more courageous. You are moving to an entirely different country with entirely different culture. It's not hard, but it's not easy either. Leaving your root and re-establishing your roots. So yeah, I think there are greener pastures everywhere. So see by yourself and live by yourself what is best for you.
Very well put. I think an own introspection of what's pros and cons for you and what is right and wrong for you is going to be the decision maker. Now, since we are talking about advice, let me also take this question. So, somebody who is starting up, a pharma aspirant who is starting his career, or maybe planning to choose in options? Because right now there are a lot of options to choose from. So what is your advice to, yeah, somebody who is at a very early stage of their careers, or maybe just passing from a particular institution and joining pharma?
Yeah. Now, this question, first of all, make me feel old. When you say advice for young people, I feel like, yeah, it's been
You are
17.
refusing to
I
age.
graduated
Don't worry.
from life, but I feel old. But thank you for reminding me I'm old. I am. But fresh people, I think I so there are different opinions, right? One is follow your passion. I think I was like who 90% of people are like me who doesn't know what they want to do in life. They have a fair idea, but not a clear idea. Oh, I want to be the marketer of this kind of company and do marketing or this kind of thing. People don't have. I think if you have a clear idea what you really want to be, not the path, that's the real aspiration in your mind. Go for it. You may not find it in first way, but keep trying it. For example, you want to be domestic marketing, right, or international, or you want to be in OTC marketing, let's say, right? You start from anywhere you get an opportunity because securing a job, you learn there, and then keep trying in parallel where you want to be. You will go into, for example, you start with analytics, you may go to Indian pharma marketing, then from there you can jump to OTC. There won't be a direct path. It's hoops and loops. You have to cross, be courageous at certain times, make certain compromises, stay away from families. It's a lot of things, but you can be there where you want. India market has ton of opportunities for right skills, so you will get what you need. If you have a clear idea where you want to be. It may take a little bit longer path and a different path than you have thought about, but you will end up. The other is you don't know where you want to go, then life will take you. But that's also okay. There are people like me, like, okay, I'm okay, whatever life path takes. But at the moment, you should be present. Whatever you got, you have to give your fullest. I think that's where things will lead. I don't want to make a religious statement, but in Gita it said, do what I want, you will get what you want. So whatever path has been thrown in front of you, follow it with your full heart, full hard work, full dedication. You will find things you want in your life. And I mean, Steve Jobs has said that clearly in his speech. If you listen to his Caltech speech, you will find the same thing. The message he's giving. Warren Buffett recently in his retirement speech, he mentioned that, hey, whatever you got, just stick to it, give it your fullest. So I think that's the gist. I would say people, if you are starting, just start where you want to be. Uh, Keep working, keep focused, and then be courageous to make moves. Don't worry about things going bad. You want to start up your business, go start your business. If you fail, you will be back to zero. No, you won't be back to zero. You will learn a lot. You will grow. You will not be back to zero. Don't get scared. Be courageous and give your best. And all the best for people who are starting their careers. I
Yeah, I'm
know you'll
reading
be
a
amazing.
wonderful book right now called Ikigai, and thank you for echoing what has been written over there. So thanks for that. In the interest of time, I want to now touch upon two technical questions. And one is, we all are fascinated by AI. Now, it's no longer a buzzword, it's a part of our daily lives. And with you in front of me, definitely, I would like to take your opinion about how AI is transforming the pharma world, and especially how the next 5 years or a decade going to look like, according to you.
Great question. I'll tell you with a fun story. I went in a store and there was a Oral-B toothbrush. On a box, it was written with AI. So AI sticker is everywhere. It's more than a buzzword. Even toothbrushes are putting AI in their toothbrushes. I don't know what AI will do, but they are putting AI in toothbrush to sell it because AI for selling you need a AI, right? It's more than a buzzword. If you want to be relevant, you need to learn AI or adapt it. You not to be like AI expert in the field, right? But AI will change or is changing already, and it's not pushed upon us. It's been there boiling, and I think it has now demoed. It's more open to people. The access is there. Earlier, it was big tech who have the access to the latest AI. Every time you type a word, I mean, for decade now, you type a word, and it will Google will suggest you what you want to probably ask a question. That was the beginning of AI. The GPT version, that was how Google back discovered, I think in 2007, if you read that paper, the transformers. And how those transformers actually adopt and now become a chat GPT version is basically started there. So AI was there, but it was more with the big tech in their environment because it's costly and very, very consuming and technical, not for everyone. But now AI is it's has followed that democratic process and everybody has access. And now it's very popular because you can just go anywhere. There are free tools you can use and chat with them. right? And it can help you a lot. So one is the adoption. So don't stay away. It's like computer work. There's a time when computer came, people who were still working on mills, everything moved to computer. AI will play a role everywhere in our life, whether we want or not. It will embed into things. It will help a lot. So start embracing it, start adopting it, start using it, not to become an AI expert, just to stay relevant, just to be at the pace, and be cautious about these things, how much you use. The second thing I would say, in our industry, in our life, I think AI we need to learn as well. If you are in data analytics, forecasting, or pharma word in certain sense of where you are helping on commercial or R&D decision making, you need to learn AI because that's going to change the game. I think Excel was discovered back in 1990s. Some of our people who will hear this video may not even were born or were in their cradles, and now we are still using that. It has evolved, but it's still the Excel, right? So I think it's that kind of a moment where things will move beyond Excel. This is a time we will see in our lifetime, in our corporate lifetime, that things have beyond move Excel, and then how AI has taken a deeper role. But it will come to people who really embrace it and learn it. Start anywhere. There is no definite path. Start anywhere. I myself attending sessions in MIT. My company is based out of Cambridge, so it's easy for me to go there, talk to people, learn there, and attend some of the free sessions they offered me. But I learned a lot there. But start embracing it, start adopting it, start reading now. There is no definite path right now how to be an AI guru, but you can start anywhere. So embrace it, adopt it, use it in your daily life. Try to think about it. Uh, the other thing which we should keep in our mind, and I was presenting at PMRC as a part of panel back in February this year, and this question came out. I was with fellow peers from AstraZeneca and other Regeneron and other company, and this question came up like, hey, how AI gonna do? It's gonna replace the analytics job? No, it's not. I think there was consensus among panel people who were much senior sitting with me on part of the panel. Everybody we six agreed, as well as in the room, that AI is not going to replace a forecaster or a data analytics like. The presentation, human belongingness, human presenting data to human is still required very much. Even the computers came, people want, it has become a tool rather than replacing. So think of it as an AI as a tool. Your job will become less about crunching and grunt work and more about presenting the narrative, helping making decisions. There will be faster way to access the data, faster way to analyze the data, faster way to present the data, but it will be you presenting the data, you helping making decisions, you making decisions supported by the tools which are available, right? So think from that direction, try to build yourself, learn AI, but also try to build how you're going to use them if you are senior, how you will use it, how you will present that output. I think that human element will never go away, and everybody has to learn how to create stories, beautiful stories which only humans can do for now.
Very well put. And thank you for putting an end to this heated debate that was also going in my mind about AI taking the jobs. But no, thanks for that. I think our viewer base would also gonna benefit from what you said, and that echoed what our Prime Minister have recently said in the AI summit, that it will create more opportunities and more unique opportunities for people going forward. Now, the last question that I want to touch upon, which has taken the pharmaceutical industry by storm, and that is the MFN policy in US and the recent announcements by it. Since you are sitting there, this question just struck my mind, and I would like to get your opinion and insights on how you're gonna see the changes coming.
Yeah, I mean, the current administration, so it was violent for a while. I think Obama Act came in, and then Biden has an IRA policy, and there was a lot of pressure on the healthcare system and pharma about the overall healthcare cost in US, which is inefficient right away. And being part of the system, both in pharma as a consumer as well, I can see the inefficiencies, right? Uh, so I would say step in the right direction from thinking about the entire country as to do better for healthcare inefficiencies. Whether it's a right or wrong step, debatable. Nobody knows, to be honest. What I learned reading through and working through, actually in forecasting world, now we have to run 10 different scenarios just because somebody has launched a new policy and everybody is taking up to junior level to up to CEO asking same questions. So everybody is understanding. I think there are certain implications here overall. every company is thinking about, but what it really means is the most favored nation reference pricing. US is a free market. You can set up price whatever you want, right? And they're like, hey, stop, you can't do that. There are certain powers who can negotiate. Medicare can negotiate, and then commercial payer negotiate. They look into data. Ex-US, there are HTAs, Australia, Europe, Japan. They look into your data and say, like, what is the efficacy safety profile? What the price you are quoting is really worth paying, the benefit we will see from this or not. So they do a much, technical judgment around the pricing. But that doesn't mean you're going to keep pricing in such a way. Prices can also be inflammatory because the benchmarks will be wrong. So nothing works. And then pharma needs money to run the industry, to run the innovation, right? So there is counter challenges everywhere. But what government has said right now, it's not about whether it's right or wrong, but he launch an executive order, uh, which is will become may or may not become policy or may change from what we know. But what current status is, they'll pick a country, certain countries, not defined yet. Most favored nation means developed country. That's the only definition, which could be mostly Europe, maybe Australia and Japan or Canada. I don't know exactly, but nobody knows. There is no definition. Pick one country and then you will be favored to that country. Same pricing in that country. Now, uh, people who want to not do good will do certain other things as well. I think most big pharma will adopt and do things in a creative way. Pricing has become a center stage. Forecasters like me are running scenario, even a deal which we haven't acquired, I'm running those scenario. What will happen if MFN will become, how this deal dynamics will look like, right? So things have changed drastically from there. I think it will evolve. Few things which when I hear people which are not on the surface and below, it will create pressure ex-US as well to have a higher pricing and be open to and contribute to innovation. I think the administration pressure is like, hey, why US? The sentiment is why US alone contribute to the innovation, and everybody take benefit. Everybody should contribute. At least the developed market should contribute, if not equally, at least to a certain percentage, much more than today's. And which I don't know. Uh, uh, if there is a way, I think there is a pressure on the ex-US countries actually. I don't know how it will evolve, but that's there. The other thing is uh, certain things will may actually favor the country. There is a provision which may extend the life of a drug from exclusivity, especially for small molecules. So hampers generic industry, but benefits pharma who are launching new innovation. They have a more lead time to for ROI. And then there is a lot of pressure on PBMs. United CEO left, Andrew Vitti, who was ex-GSK as well, but I don't know why. Shares are down for every healthcare company and every insurance and PBM. There are a lot of pressures. They want to cut the middleman as well. So it's not just pharma; it's healthcare, evolving healthcare system in itself. Everybody's trying their own way of reducing the inefficiencies. It's not my job to debate about what is right and wrong. We have to really embrace it, what's been put in forward to us, and let's see how things evolve. Uh, uh, how things evolve. It may have dramatical implications on industry, but yet to evolve. Let's keep an eye. Something to be monitored for sure.
I appreciate for you providing a comprehensive overview of the situation. I'm truly enjoying a conversation with you, but now it's time to go ahead with the round two, which we call it as a rapid fire round. So I'm going to role play Mr. Bachchan here and throwing some light-hearted questions to unleash some of the insights about your personal journey, some of the principles that goes behind the curtain. So quick questions, quick answers, and I'm going to look away. I have a bigger screen in front of me, so I'm going to look at that. So are you ready?
Am I ready? Yeah, let's see. I'm ready.
Sure. Okay. So, what one philosophy or belief that has stayed with you throughout this journey?
Uh, I would say there is something to learn from everything.
True.
I believe in a philosophy of Dattatreya. If you want to read more, he has 11 gurus, including Snake was one of his gurus. So he said there is everything, there is something to learn from everything, and that's I sticks very closely to me personally as a value as well. Yeah, I would say that's my
Okay.
philosophy.
Moving to my favorite question, one advice that you give to your younger self
Now,
now.
yeah, I think two advices. I was thinking back last year, one in life and one in career. I'll give two advices rather. One was invest early. As soon as you start your career, I was not investing. I didn't know how to invest. I didn't spend time how to invest. I spent my money on more layer things rather than investing, which I would have invested earlier. Like where whatever you do, invest early in whatever form. So career wise, I would say be more courageous. Uh, I I didn't touch upon maybe another time. I opened my own ad agency in a little bit when I in parallel to my job. I worked very well. I really enjoy that thing, having a small ad agency and working with my people to create new pharma marketing ad stuff. Wish I have shown more courage and build it, scale it up. So courage, yeah. At many stages, I should have shown more courage. I decided the easiest part, which I have decided the hardest part, choosing the hardest part. Yeah.
If not pharma, what career path or choices you would have taken?
Yeah, in this is funny actually. Career path. I think pharma. I told you, pharma chooses us. We don't choose
Yeah.
pharma. But I wanted. This is very weird thing. I usually say this when I was in like 9th, 10th. I used to watch National Geographic a lot. Really inspired. I wanted to be a zoologist and being like outskirts and studying animals. I do in my spare time. I read a lot about different animals, and I wanted to. I probably would have been like what I've been doing. I don't know, but I would have chosen a path either in art or as a zoologist, nature explorer,
Zoologist. Wow, that's quite a unique
and maybe
answer.
bats. I'm fascinated by bats and Batman as well. So you may have studied bats, characterology, you say?
I just wanted some recommendations of books or podcasts from you, which has inspired you in your journey.
Oh yeah, I think I can give you a very nice list. But at least few books I haven't seen very popular, but I would suggest. One, if you are in pharma or any industry, read a book called Super Forecasting by Philip Tetlock. Amazing storytelling, amazing storytelling. He and his peer, if I tell you a little bit more about it, because I
Yep,
always
yep, yep.
tell this book, it tells about a story. They open it, not a story. They see whose people are really good forecasts and can predict the future. They open in a big competition in US, and people from Harvard, MIT, everybody contributed. It's still alive. You can go there, contribute, and see how whether your forecasts are true or not. Most of the big institute actually failed, and some people were really good. And then he found why, and these were random questions like, hey, X and Y celebrity, how long they're gonna stay? Is this divorce gonna happen or not? Or something happened in here, how it's gonna evolve, how Iraq war gonna evolve. And there were people who were able to predict accurately most of these things. And there are many people who were not. And he found out the trait, what are the traits to be a good predictions? And it's not forecasting. In general, you give a different perspective, how you see the world, how you consume the data, how you use your instincts over the data to actually make a decision. So I would say anybody, at least in pharma forecasting or analytics, should read it. It's very interesting read. It's not a boring book. It's a very good storyteller. It changes your perspective, how you see things, especially in forecasting. So Super Forecasting by Philip Tetlock. It's not pharma book. It's not analytics book. It's a storytelling book. And what makes a good forecaster a good forecaster. And then this is done by government of US. I mean, there is contribution in that setup. The podcast, I would say there is a Bloomberg podcast on China deals recently I heard, which opens up your brain like how China has competing and creating new innovation. 30% of deal in last year happened through China. Those molecules were invented in China, and that will go up irrespective of the geopolitical stance. I think you will see more partnership from China. There is a lot of lesson India can learn or other countries can learn how to make an innovation hub, right? And I wish we do something there in India as well. Uh, things are changing, and we should embrace and adopt it. Then one book I always carry with me is Alchemist. It's kind of be courage and chase your dreams. That's the summary. That I enjoy reading. I have read more than one time. It's a nice book.
No, be courageous is the unique message that is coming out of this podcast, and definitely, I'm really motivated by all the examples that you have given. One productivity hack that you swear by.
What I do is I start my day with a good amount of water. And then before I start my work, when I sit on my desk, I have a notebook and a paper. I will note down things I have to do today, personal, professionally, to complete. I will read emails then and add more things to my list. My goal is when I put everything brain down, it gives me structure to the brain, and it makes you more productive. You are not juggling from one tick to another. You're not distracted, sort of being in the teams. You know what you have to do, what you have to accomplish. Uh, uh, and if makes you think calm and be more focused on stuff you're doing. So that's what I do.
What is the best thing according to you working in pharma?
For taking care of patient life, especially now, helping patients see that clearly. We don't see sitting in forecasting, sitting in an office room and sending the numbers in a PowerPoint or Excel. We don't see that. Go out, see, read about your brands you are working in social media. Just you don't need to like or click or do anything silly there, but just go there, read about how it's changing patient life. I and indirectly, we are shaping patient life. Uh, I work in field of oncology. I sometimes go on, these patient videos they have posted about our product, or sometimes they are, company do for their own marketing purposes as well. Just go there, listen to their real stories. It's very motivating and gives you boost. Yeah, I think indirectly we are taking care of patient life, which is personally very, very close to me as well.
Great. And in interest of time, let me take the last question. If you could have dinner with three people, living or not, who would they be?
I'll start with Nikola Tesla. It's very fascinating. Obviously, he's still in many form with all the social media things. Really fascinated by his way of discovering things, which was very, non-traditional in certain way. So Nikola Tesla was one. Uh, Mr. Modi, Prime Minister Modi. I think at this stage, I don't want to miss an opportunity to see him, meet him in person. He's kind of doing great. Uh, and the third person I would say would be ancient king Chandragupta Maurya. I have read history, and I was like his journey starting from a humble background to setting up an empire, which was from one angle to another. I think there are a lot of stories which are never told to us, but if you read the history books, you will know how he has shaped where we are today. So probably see him or meet him. Seems like a philosophical chat thing now, but that comes top of my mind.
No, great to cover. You covered mythology, business, and science in your answer, and that's, I think, great note to end the podcast. But I have learned a lot today interacting with you. I think we spoke for more than 1 hour. And then, right, it just happened the way you narrated your personal experiences and amazing insights. I'm very sure that it's also going to benefit a lot of our viewers. So thank you for your time. Thank you for speaking with us. And to audience, you can also reach out to Pulkit in case if you have any specific questions or any specific doubt. He is an amazing human being and always ready to help and answer. With that, you are watching BRiK Academy. And if you have not yet liked and subscribed to our LinkedIn page and our YouTube channel, please do that so that it acts as a motivation to bring experts and wonderful leaders like Pulkit to you. So with that, I am signing off. Have a great day ahead, and please take good care of yourself. Thank you very much.